The foundation of our success here at the UPMC Concussion Program is our true comprehensive multidisciplinary approach and specialists talking to each other to benefit the patient's care. When an out-of-region patient comes to our program, they will see a variety of specialists, and the first specialist would be a neuropsychologist, where that individual will do a detailed clinical interview, kind of serve as the point guard for the patient's day, but do a detailed interview, do neuropsychological testing, whether it be computerized or traditional paper and pencil testing, and also vestibular oculomotor screening. Following that appointment, the patient will then receive a much more comprehensive vestibular evaluation with one of our neurovestibular therapists. That therapist will not only look at the vestibular system, but the oculomotor system and understanding the role those systems may be playing on the patient's symptoms and presentation. Following those first two appointments, the patient will then undergo an exertional evaluation where we'll actually activate the patient to figure out the influence on dynamic movement on their symptom presentation and actually coming up with an active approach at rehabbing and working through the symptoms that may be present. Following that appointment, the patient will see our primary care or physiatrist, where both a neck evaluation and a medication evaluation will occur. We don't always use medications in our treatments. However, that's an option with patients that are seen here. Following that appointment, the patient will then typically undergo a behavioral optometry evaluation, where we do a very detailed assessment of the patient's ocular motor system and the influence that may be playing on the patient's symptoms. Believe it or not, after that all occurs, we all meet as a treatment team, and then the neuropsychologist will sit the patient down and very specifically outline, this is the plan we're going to implement, this is the rehab approach, this is how we're going to approach the injury, and to get the patient back to full health. The patient will then take that program home, and typically that can be a home program that's done independently and done by the patient in a very specific and outlined way. Of course, we can always bring in other specialists as needed. But again, the true success of our program is different disciplines working together, talking, and really coming up with an appropriate plan to get the patient back to full health.